How's everyone? Good. Thank you for being here, everyone. Thank you.
It's great to see everyone. If we can just wait for one more moment, I think there are a couple more people joining, so we'll just give it one more minute, if you don't mind. Okay, I think it has been an actual minute. We have had a couple other people join. There may be a few others joining as we begin, but I would like to kick us off and welcome all of you. Thank you for being here today. I will officially convene the meeting of our Pediatric Hospice Working Group. And we'll begin with introductions. I am State Representative Kristen McCarthy-Vahey, have the privilege of serving as the co-chair of the Public Health Committee and representing Fairfield and Bridgeport. And I'm really grateful to every one of you who has come forward to discuss this very important and difficult topic of pediatric hospice in our state. And we will begin the meeting with introductions. And with that, I am going to turn it over to Senator Anwar.
Thank you, Madam Co-Chair. I'm keeping my video off because of bandwidth challenges I'm having, but this is a very important group. It's a group that was brought to our attention because there was one child in our state with Senator Jan Hockadel's district who did not get the care that we would have wanted our family members to get. And that raised awareness that we do not have a robust, sustainable pediatric hospice opportunity in the state of Connecticut. That's why we wanted to have this conversation. And we wanted to create a group to be able to guide us. And the more we have learned, we needed individuals with a background and experience who would be able to give us guidance and understanding and policy recommendations to be able to address this. And we cannot thank each and every one of you for making this a priority and volunteering your time, wisdom, experience, so that we can, as a state, do better. For hopefully very, very, very rare occurrences when one of our child in our state needs help. But we want to be ready and we want to be prepared and we want this to be sustainable. So thank you so much. And I'm sorry, I'm Senator Saud Anwar, co-chair of the Public Health Committee, currently representing East Hartford, East Windsor, South Windsor, and Edmonton. Thank you, Madam Co-Chair.
Thank you so much, Senator Anwar. And we also have with us today the good Representative Nicole Claridis-Dietra from the 105th District. Rep. Claridis-Dietra, it's great to see you.
Great to see you. Thank you, Madam Chair. I'm State Representative Nicole Claridis-Dietra. I'm ranking member in public health. I represent the great district of Seymour, Derby, and Beacon Falls, 105th. I'm sorry if my phone just froze, but I have bad Wi-Fi here at work. I think this is important work. I thank everybody for taking the time to be part of this working group, you know, for our babies and children in Connecticut. So thank you, everybody. Looking forward to some important work here.
Thank you, Representative Claridis-Dietra. Indeed, probably some connection issues. We could hear you. You cut out a little bit, but we did get to hear you. And before we go further in introductions, I will point out that officially the co-chairs and ranking members of public health are officially designated members of this working group together with all of you. And with that, I'm going to go down the list I have in front of me. I think all but one of you are here. And so I'm going to start with Tracy Wodach.
Thank you, Representative McCarthy. Hi, everybody. My name is Tracy Wodach. I believe I know just about everybody on this call. I'm the president and CEO of the Connecticut Association for Healthcare at Home. Part of our membership are the hospice providers throughout Connecticut. I'm also a member of the Palliative Care Advisory Council with a few of you on this call, and we definitely have identified a significant gap in pediatric hospice care in the community. So looking forward to working with everybody for some potential solutions.
Thank you, Tracy, and thank you for also referencing that there have been other conversations, that this really is a continuation of a few different conversations that we're hoping to bring together here in this group and very clearly focused towards any legislative changes that we might need to make. So thank you for that and for your work that you're doing in so many areas, as all of you are. Next is Tony Ann Marchione.
Good afternoon. Thank you. My name is Tony M. Marchone. I'm the president and CEO of Regional Hospice in Danbury, Connecticut, and we presently serve pediatric patients in Fairfield County, a little bit of Litchfield County, and we go into New Haven County, and we are so excited to be part of this group and part of this conversation. So thank you.
Thank you so much, Tony Ann. It's wonderful to have you here. Next is, I see Dr. Ross Albert. On my list, you're listed as Albert Ross, so you're going to help make sure that we all know
Yes.
properly.
I have a
Welcome.
curse of two first names. Albert is my last name, so I'm Ross Albert. Thank you. So I appreciate the opportunity to be here as well. I'm the hospice medical director for Hartford Healthcare at Home, and I was the palliative care director at Hartford Hospital previously. We also are lucky enough to have done and are doing pediatric hospice care in the state as well, primarily focused in Norwich with Center for Hospice Care, which has been a component of our care, but also through their expertise, we've been able then to do it in Hartford and the Hartford region as well. So glad to be here. Thank you.
Well, thank you, Dr. Albert, and thank you for correcting us. My apologies about that.
That's okay.
Next, we have Erica Alexander.
Hi, good afternoon. My name is Erica Alexander. I'm the hospice clinical manager with Day Kimball Healthcare at Home. We are in Thompson, Connecticut, and we service the northeastern corner. We don't currently serve pediatric hospice per se, although a few years ago, we did coordinate very closely with Boston Children's. So I'm happy to be a part of the group and hope to learn more and have our agency be able to help further. So thank you for having me.
Wonderful. Thank you so much and welcome. And Karen Garley.
Thank you, Senator Representative McCarthy. I'm Karen Garley. I am the Hospice Program Director for Yale New Haven Health at Home. We have serviced a number of pediatric hospice patients. We currently have one on service now, and I'm just really excited to be part of this panel.
Thank you, Karen. We're excited to have you as well. Carl Schissel.
Thank you, Madam Chair. And my name is Carl Schissel. I work at the Connecticut Hospital Association. I'm a senior director of regulatory advocacy. I've been there about 15 years now. In terms of credentials, I'm not a clinician. I'm an advocate. The Connecticut Hospital Association represents all the hospitals of all varieties across the state. In my work at CHA, I do work with specialists who are involved with the care teams, for pediatric hospice and hospice generally, most notably the spiritual care directors and the behavioral health, directors as well. While I'm not on the Palliative Care Advisory Committee, I know this is not necessarily related, I do recognize Barbara Cass and Tracy Wodach as longstanding colleagues of mine on the Medical Orders for Life-Sustaining Treatment Advisory Committee. I think we're all original members of that. And frankly, we were working on it before the bill passed. So it's nice to see a lot of familiar faces. And I look forward to learning from you and working with you to achieve a very positive outcome. Thank you.
Thank you, Carl, for your many years of work and for again referencing the very important foundational work that's been done for so long and that these are ongoing conversations. I appreciate that tremendously. And speaking of your colleagues and partners for many years, we'll go next to Barbara Cass.
Good afternoon, Representative McCarthy-Vahey and Senator Anwar and members of this working group. I am Barbara Cass. I'm the Senior Advisor to the Commissioner of Public Health for Long-Term Care, and I have been privileged, truly privileged, to be able to work with and participate with the Palliative Care Advisory Council, and also, as Carl has mentioned, with the MOST Advisory Council. And there's lots of intersection with this work, and delighted that I'm able to participate in this really, really important work. Thank you.
Thank you so much, Barbara, and thank you for, again, that pointing out that intersection. I know that we will be drawing on the work that you all have done. Regina, and then we're joined by Senator Heather Summers. So Regina, please proceed.
Hi, good afternoon, everyone. My name is Regina Wusu. I'm a nurse consultant with the Department of Social Services, and I am the Social Services designee on the committee. And I also work with our medical consultation and clinical team at Social Services. So I'm glad to be here.
Wonderful. Thank you. To have the expertise of both the Department of Public Health and the Department of Social Services will certainly be helpful and informative to the conversation. Senator Summers, welcome. We're doing introductions.
Okay, good afternoon. I'm sorry I'm a little bit late. I have 5 meetings at the same time today, like our wonderful schedules that never slow down. My name is Senator Heather Summers. I represent Eastern Connecticut, Southeastern Connecticut up to the Rhode Island border. And I represent 8 towns. I've been on public health for going on 10 years as the chair and now the ranking. So I'm interested in the great work that this committee and working group is going to do. Thank you.
Thank you, Senator Summers. We also have, I see Matthew Festa from DSS. Would you like to introduce yourself?
Thank you, Representative. Good afternoon, everyone. My name is Matthew Festa, the legislative analyst at DSS. It's great to be with you all.
Welcome. We're glad to have you. And the wind beneath our wings, the people who help us do this work every day. We have Beverly Henry and Peter Kolakowski, our committee clerk and administrator. And I would like to give them an opportunity to introduce themselves so that you know who is helping support the good work that we are doing together. Beverly and then Peter.
Good afternoon, everyone. My name is Beverly Henry, and I am the administrator of the Public Health Committee. I see quite a few familiar faces.
Thank you, Beverly. Peter.
Good afternoon. My name is Peter Kolakowski, and I'm the clerk of the Public Health Committee.
Thank you all. And I will recognize and thank CTN is here to record our conversation and share it so that people can have access and learn more about the important work that you're doing on behalf of the families of the state of Connecticut. So with that, we will move.
Representative Vahey or McCarthy-Vahey, I was just noticed Dr. Moss is on here as well as really I'll say humbly, I do a little bit of pediatric hospice, but she's our pediatric palliative care and hospice superstar and expert. I didn't want her to get missed in the mix.
Dr. Albert, somehow, Dr. Moss is definitely not going to get missed because he's going to have a very important role in this committee. But I did somehow miss your name on my list and I saw you there. Dr. Moss, please forgive me. Please introduce yourself.
Good afternoon, Representative McCarthy, and no worries at all. It is a busy day for all of us. I am so delighted to be here. My name is Carrie Moss, and I'm a physician at Connecticut Children's, where I am a pediatrician, a hematologist, oncologist, and a palliative care specialist. And so it has been my privilege to develop our palliative care program, a life work at this point, the Sunflower Kids that we are exceedingly proud of. We take care of kids throughout Connecticut and into Massachusetts. And we are just so thankful that a constituent is the reason that we're here today, but we are so delighted to pick up the ball and run forward to create an entirely different landscape for the children of Connecticut. We do so well by them in so many ways, but this is definitely an area with opportunity and improvement. And I look forward to working with all of you to provide better services and to just collaborate together to make this a good experience for all.
Thank you very much, Dr. Moss. And I think, Dr. Albert, I was jumping ahead into the next agenda item, which, again, which Dr. Moss may play a very important role. But thank you all so much for the introductions. As I was saying, and I appreciate very much that heads up and the teamwork there, Dr. Albert. CTN is here recording our conversation, which is a great opportunity. And just wanted to point that out so that you all know that we will continue to have a public and open meeting process. In addition, the meetings will be available via YouTube as well. So just wanted to make sure that you knew that the meeting materials will also go on the Public Health Committee website. So we will move on to the next item on our agenda, which is the designation of co-chairs. And the conversations that have been happening have led to the recommendation of asking Tony Ann Marchione and Dr. Moss to be the leaders. The group, all of us here together get to make that designation and decision. But I would ask if that is the case, Dr. Moss and Tony Ann, if you wanted to say a word and then hear from anyone else in the group.
Do you want to go first, Carrie?
You're unmuted. You go first. Go ahead.
Okay. It would be first and foremost my honor to not only co-chair this group, but to co-chair with Dr. Moss. We've been doing a lot of work together, I think, trying to work behind the scenes in getting kids taken care of in the state of Connecticut in the best way that we can. There's a lot of passion, I think, in making something work for pediatric hospice and palliative care, although I find those words are like interchangeable a little bit with pediatrics. So for me, this would be an honor, and my true passion is to promote the pediatric hospice in the state of Connecticut.
Thank you, Tony Ann.
So I echo Tony Ann's sentiments. It's been a privilege to work with her. It's been a privilege to be on the DPH committee that has identified some of these needs. Palliative care has been a hobby of mine, as it were, because of the funding that was allotted to it when I first started doing this work. And it's really become my professional passion. And in developing the Sunflower Kids program, we named our program for sunflowers because sunflowers are the most resilient flowers. They grow in any soil and any condition and show resiliency, just like these amazing children and their families. We also know when the sun is not out, the sunflowers look towards each other for support. And we like to think of this work as the opportunity to be sunflowers, right? On the days when it's hard to look towards each other for support. So the thought of taking this professional passion into something that actually evolves into a greater venue in the state and in the legislature is something that would just be a true honor and would really be just defining for the work that we've been doing all along. So thank you for considering. I would welcome the opportunity to lead this with you.
Thank you both for your comments and your willingness to serve in this capacity. Are there others who have comments or interest, or just would like to add anything? Senator Summers?
I would just like to nominate the two physicians that we just spoke about to be the chair and the co-chair of this working group.
Thank you so much for that, Senator Summers. We can do this formally too. Is there a second to that nomination? Second. I see Tracy Wodach raised her hand to second. And any discussion? If not, I would say all in favor.
Aye.
Just say aye or raise your hand.
Aye.
All right. Any opposed? Abstentions? And I think you two are going to be tremendous leaders. Congratulations. And more than anything, thank you for your willingness to serve in this capacity and to help guide this conversation, given your background and experience. And it's wonderful to hear about the ways that you work together and we'll build off one another's strengths. I think that's a true gift for us as a state. So thank you. Again, I can't say thank you enough to all of you. So with that, we will move to item number 4 on the agenda, which is the working group scope of work. In your invitation, you should have received the PDF that has the reference to Public Act 2419, which was section 29. And in this document, it simply outlines the membership of the group, the designation. It also then goes through what it is we're asking you to do. No later than March 1st is the goal of getting back to the legislature. But I'm going to just go through these again for public purposes and just transparency so that we have that together on the record, which is making recommendations for the levels of hospice services and pediatric patients across the state. And that is certainly a part of this conversation, was the statewide aspect. Looking at payment and funding, always, that's a perennial issue in everything. So those are really the two main aspects, which have the ability to offer a wide range of conversation. So I would say you're not constrained terribly. This, I think, can lead to a lot of other conversations. We are having our first meeting now. We've elected our co-chair people, which is wonderful. As I referenced earlier, Beverly and Peter will be our support persons. I will make note, as I have with our multiple other working groups that we are getting started this week, that as a legislature, we do put dates in, and oftentimes groups sometimes it can be hard to meet those dates. You guys have a little bit more time than some of our other working groups, which have that January 1st date. And ideally, the ability to get that back to us allows us then the potential to take that and put it into legislation if needed, or likewise, if it needs to go to agencies for action. Are there questions or comments about the scope of the group? I suspect there will be lots more conversations. I know there will be, but that way we're all on the same page on that. Okay, if not, we'll move on to the meeting schedule, item 5. I'm mentioning the other working groups that we have. We all share one YouTube channel and one Zoom platform. And I realize, with apologies to the co-chairs, and I have not had this conversation with you, we're wondering if we can keep this general time frame going forward. And that way, because of the other groups that have gotten started, we know that this is a designated time slot. Is this a workable time period for first the two of you as co-chairs and then others on the group?
Yes.
And I see a thumbs up from Dr. Moss. I see other head nods. What I will say before taking other comments is we know that not everyone will be able to make all of the meetings. That is inevitable. And that's why I mentioned the fact that you will have access to YouTube as well as the materials on the public health website, so that if you are unable to attend, you will be able to listen in. On YouTube, you can even speed us up at 1.5 speed and catch up on the meetings. But otherwise, are folks able to stick with this general time frame if we look at that going forward? I see other head nods. Okay, so I'm going to assume that's a yes. In terms of timelines, if we are able to maybe look at 2 weeks out for the first meeting. Give me 1 second, my apologies. Okay. This would be the 9th of October at 3:30. Is that acceptable for you, to our co-chairs? Yes, I see one. I'm looking, there we go. Okay. Because you all have a little bit of a longer runway, one thing I might suggest is, rather than looking ahead at the specific dates for the other meetings, that we give the co-chairs an opportunity to have some conversation with us. If you're able to, at the end of this meeting, stay on to talk with Beverly and Peter and myself, to talk a little bit about that op tempo. And you probably have a pretty good sense of what you're hoping to do there. And if you want any comments now, I'm very open to that, or we can touch base afterwards. Tony Ann or Dr. Moss? Nope, you're okay to touch base at the end of the meeting and we can.
Yeah.
Yeah.
Okay. So we have covered item number 6, which is the next time and date is October 9th at 3:30. And are there any other comments, questions, or anything else before we adjourn and Dr. Moss and Ms. Marchione and I meet to touch base about logistics? Anything else?
Madam Co-Chair?
Yeah, Senator Anwar, there you are. Sorry, I missed you.
Yeah. No. I just wanted to thank everyone for being part of this, and I just wanted to mention again that we are hoping that we will have recommendations that are going to make sure that all of our children in our state who need this help will receive it in a timely fashion. And we can't thank you enough for your time and your experience and wisdom. Thank you. Yep.
Thank you, Senator Anwar. Any other closing comments, Senator Summers or Rep. Claridis Ditria? I see you, Rep. Claridis Ditria.
Thank you, everybody, for being here. I'm sorry my Wi-Fi was wonky before, but like I said, for those of you who didn't hear me, thank you all for doing this. This is really important work that we're doing, and hopefully we'll move all this forward this coming session. Thank you, Madam Chair.
Thank you. Senator Summers?
Just again, thanks to all the participants. We know how difficult your schedules are, being clinicians, and we're really excited that you can be here, and we're hoping for some really good, positive steps forward for Connecticut and the children that live there for their healthcare under these difficult circumstances. So we're looking forward to learning a lot from you and coming out with some great policies that we can push forward.
You can see, thank you, Senator Summers. The theme of today's meeting is thank you. So I guess with that, I will say thank you. And now we get to work. I hope you all have a wonderful rest of your day. And Ms. Marchione and Dr. Moss, if you don't mind staying on with us, that would be great.
Thank you.